Hello everyone, we are trying to take some initiative to spread awareness about virus COVID-19, which is also known as corona. We are making content on coronavirus to spread awareness about this pandemic. Considering the ongoing COVID-19 pandemic, many fraudulent messages are being circulated on social media and other communication networks related to the spread of the virus through ice creams and other food items. The Indian Ice Cream Manufacturers Association (IICMA) reassures everyone that ice creams do not carry the virus. In fact, no food items can spread the disease. To avoid the spread of coronavirus and to stay safe, one needs to wash hands frequently and wear a mask in case unwell. One can visit the following links for more information and clarification. Moreover, there are many general advantages of having ice creams, such as, it makes one feel happier, it is a huge source of vitamins and minerals, it's a source of energy for the body too, it helps to boost immunity, and many more. IICMA requests everyone to join the fight against misinformation to ensure people have the correct facts about COVID-19 so that they can protect themselves. To fight against corona, one doesn't need to avoid food items, rather wash hands often, wear a mask while traveling and in crowded place, eat balanced diet food and absorb information from reliable source, etc. About Indian Ice Cream Manufacturers Association (IICMA). The Indian Ice Cream Manufacturers Association was founded in 2011 as the National Association of Ice Cream Manufacturers. It is a professional non-profit organization representing the ice cream and frozen desserts industry in India. Here's the good news: the science around coronavirus continues to unfold, but there is currently no evidence that the disease is transmitted by food, says Donald Schaffner, Ph.D., a distinguished professor in the Department of Food Science at Rutgers University in New Brunswick, NJ. That's because it's a respiratory virus, passed primarily from person to person in droplets when someone who is infected coughs or sneezes. Though it's possible to pick up the virus by touching a surface where the droplets have landed and then touching your eyes, nose, or mouth, that's not the primary way it is thought to spread, according to the Centers for Disease Control and Prevention. The CDC, the Food and Drug Administration, the Department of Agriculture, and the World Health Organization say that food is not known to be a route of transmission of the virus. And the information available from outbreaks of SARS and MERS, caused by coronaviruses similar to the one that causes COVID-19, is reassuring. According to the WHO, the evidence showed that those illnesses were not transmitted by food. That said, it always makes sense to practice good food safety habits. The same things you do to prevent infection with bacteria that cause foodborne illness, such as E. coli or Salmonella, would protect you against any virus, says James E. Rogers, Ph.D., Consumer Reports Director of Food Safety Research and Testing. They found that the virus remained on plastic and stainless steel for up to 72 hours. On cardboard, they found no viable virus after 24 hours. But the virus begins to degrade quickly. The half-life, or the time it takes for the concentration of virus to drop by 50%, was 5.6 hours on stainless steel and 6.8 hours on plastic. The half-life on cardboard was a little more than 3 hours, although the researchers said there was a wider variation among the samples they tested than for stainless steel or plastic. Just because the virus is there, doesn't mean that there are enough viable particles there to infect you, C.R. Rogers says. And the chances that any particular package was exposed to all the factors that would be necessary for it to have the virus on it in the first place are also low. No, Chapman says. I actually see it as a very good alternative since, unlike grocery shopping, it greatly reduces the need to interact with other people. Most restaurants have instituted contactless delivery or pickup practices that allow people to prepay for their food and receive it without coming close to another human. The biggest risk factor for the disease is interacting closely with other people, and contactless delivery eliminates that, Chapman says. To further reduce your risk, transfer your food to a plate when you get it, dispose of the containers, then wash your hands before you eat. It may feel safer to switch to single-use disposable bags during this outbreak, but experts say that's not necessary. I do launder my reusable cloth bags after every trip to the grocery store, Chapman says. We don't have any evidence that they're transmitting illness, but it's a smart practice. Washing grocery bags will keep food-borne bacteria from multiplying. When you get home from the store, put away your food, toss the bags in a hot water wash, then wash your hands. Thanks for watching. To watch our latest videos, subscribe and press the bell icon.